So let's begin. Carbolic acid. Carbolic acid is organic corrosive acid. Okay. Classification: organic corrosive acid. So what we find when আমরা identification part আমরা কি রকম দেখতে পাবো, it will be normally pink in color. Okay. So ordinarily যখন আমরা পাবো কোথাও সেটা pink in color হয়, but in pure form it is usually colorless. Okay. In purest form it is colorless, prismatic. Okay. Needle shaped or crystal like. আমাদের কাছে আছে, দেখিয়ে দেবো এখানে. So colorless, prismatic, okay, crystalline mass. সেটা হলো normally in pure form, but what we will get when it comes in contact with air, it becomes pink in color. Okay. তো যেটা তোমরা পাবে, তোমাদের স্যাম্পল যেটা দেওয়া হবে সেটা ওইভাবেই লিখে দেবে যা কালার পাচ্ছো। Okay, whatever the sample is given in exam, you will write that only. যদি পিঙ্ক কালারে থাকে পিঙ্ক কালারে লিখবে, যদি ওই ক্রিস্টালে থাকে তাহলে ক্রিস্টালে লিখবে, কালারলেস ক্রিস্টাল কার্বলিক অ্যাসিডে। Okay. So fatal dose is about 15 gram on average and fatal period is 3 to 4 hours in average. Mode of action, it has both locally and remote action. লোকাল অ্যাকশন যেটা হতে পারে সেটা হতে যদি লার্জ কোয়ান্টিটিতে যদি আমাদের স্কিনের উপরে পড়ে, then it can cause corrosion. Okay, there will be sloughing of skin, scar formation. Okay, the skin will become hard, brittle. So if it falls on skin, and if it is ingested, then it will corrode the gastric mucosa. Okay, এগুলো লিখতে হবে. And it is called a protoplasmic poison. So that is an important term, protoplasmic poison, because it coagulates, it precipitates the proteins and it coagulates the cell contents. Okay, that's how it works and causes cellular death. So it also causes extensive capillary damage and clotting of peripheral vessels. Okay. So SR formation টা একটু আমরা জেনে নেব কি হয়. So if it falls on skin, intact skin, so what will happen is there will be SR formation, and after that, that skin will get eroded and there will be a brownish stain. After few days, ota erode hoye jaye, fall off hoye jaye SR ta, and the skin will be brownish in color. Okay, that is SR formation. Ota ekটু bolte hobe. So if somebody doesn't remove the acid by washing, মানে স্কিনের উপরে পড়ে গেল, then যদি ধোয়া না হয়, then it will cause sloughing of the skin and more damage to the skin. Okay. So medico-legal aspects এ কি লিখবে? Medico-legal aspects is same, commercial use and criminal use, commercial or judicial use and criminal or injudicious use. So commercial use, carbolic acid আমরা জানি কোথায় কোথায় ব্যবহার হয়, as cleaners or in laundry, even in metal industry, rubber industry, textile industry, এগুলোতে ব্যবহার হয়। as well as দেখবে কার্বলিক অ্যাসিড ব্যবহার করে অনেক জায়গায় সাপ তাড়ানোর জন্য, ঠিক আছে, but it doesn't works that way, so it doesn't repel any snakes. People say that carbolic acid দিয়ে দেবো সাপ আসবে না, but that's not true. Carbolic acid has nothing to do with snakes. Okay. So in criminal use, off kore daw. That. Okay. So accidentally it may be consumed, but it is very rare. It can be consumed by the children normally. Accidental, যখনই accidental wordটা আসবে বাচ্চাদের কথা মনে করবে and write it down. So another one is homicidal is not common. Homicidal is not common, though it is bitter, sweet, burning, sweetish taste. It tastes burning, sweetish taste. Okay. এই যে crystal গুলো থাকে. Still homicidal, it is very rare. And abortifacient, it can cause abortion, but it will lead to more damage. Okay. So illegal abortion এর সময় ব্যবহার করে, anything they use. So for foreign body reaction and all. So it can be used, but it's not that successful. Okay. signs and symptoms. এটা একটু ইম্পর্টেন্ট, সাইন্স এন্ড সিমটমস। কার্বলিক অ্যাসিডে কার্বলিক ও থাকবে, ঠিক আছে? সো দেয়ার উইল বি constriction of pupils, and the urine কি হবে? First there will be oliguria মানে scanty urination. Later on what will happen is if they pass urine also, it will be normal, যেমন urine হয় তেমনই হবে, but when it comes in contact with air, it turns olive green in color. Okay, olive green urine মনে রাখবে, because this carbolic acid, also known as phenol, it in contact with air, there is oxidation, and that oxidation there will be a products called as hydroquinone and pyracatechol. Okay, so this changes color to olive green urine. Okay, so the person will not pass olive green urine, person will pass normal colored urine, but it will in coming contact with air, it changes color to olive green due to oxidation. Fine, clear? Tale constriction of pupil and there is olive green color urine. Okay, ei duto ekta point ache. So it has got an anesthetic effect on stomach. Anesthetic effect er significance ki hocche whether to insert gastric lavage tube or not in the stomach. Okay, so the answer is yes, one can put gastric lavage tube in the stomach, but under precaution. Precaution is that there if it is done, মানে আগে যদি আমরা গ্যাস্ট্রোস্কোপি করে দেখে নি যে whether there is erosion or not, if there is erosion and if there are chances of perforation, then we will not do it. Okay, stricture যদি হতে পারে তাহলে we will not do it, otherwise we can perform it because it is a weaker acid. ঠিক আছে, its corrosive action is not at par with the sulfuric acid. Fine, signs and symptoms. এরপরে আসছে treatment is same, ওই gastric lavage should be done cautiously, and what you will do, compound কি দেবে, it will be sodium sulfate and max sulf solution 50-50 ratio তে with 500 ml of water mix করে gastric lavage tube দিয়ে দেওয়া যেতে পারে. So it will cause to form sulfocarbolates. Okay, sulfocarbolates are normally harmless and it will be excreted out. ঠিক আছে, বোঝা গেল? sulfocarbolates তৈরি হবে due to administering of max sulf or sodium sulfate solution. Other things that is the এটাই হচ্ছে antidote. Okay, this is the antidote. So if somebody asks you what would be the antidote, you say that we administer mixture of max sulf and sodium sulf solution in 50-50 ratio in 500 ml of water, and later on we can, that is the antidote, and later on we can keep it in the stomach for some time so that it can work later also, or it will get ingested in the intestine, mane proximal intestine and all. If the poison is there also, it will neutralize it, mane otake carbosulfolates তৈরি করে ওটাকে harmless করে দেবে. Okay, other things we can use is demulcents. Demulcents কি হচ্ছে, it protects the gastric mucosa, that could be used, and activated charcoal can be used. Intravenous infusion of saline can be given in case the sodium bicarb level in the blood is less. So normally we do a ABG te amra dekhi whether what is the level of bicarbs, sodium potassium electrolytes level দেখে ওটাকে আমরা correct করার চেষ্টা করি. Whatever there is irregularities, we correct it. That is symptomatic. Okay, or in cases of skin যদি পড়ে থাকে, you wash it with soapy water and you can apply 20% alcohol or olive oil or vegetable oil on those surface for neutralizing and all. Okay, so PM findings আমরা কি পাবো? The angle of mouth and chins যদি consume করে থাকে, there will be excoriation, sloughing, and there will be staining of the tissues. It will be dark brown in color. Okay, and the mucous membrane of mouth, esophagus, that will change in ashy gray in color. Okay, ashy gray to brownish color. And kidneys, you will find the features of renal failure. Mane, there will be hemorrhagic spots, it will be congested, and features of renal failure. Renal failure is dusky pale cortex and dusky medulla. When we dissect the kidney longitudinal section, we see it by naked eye. We find a finding, and if we can do a histopathological examination with the tissue, that will give us a more detailed report. Okay. So normally in all poisoning cases, the viscera are preserved. So whenever there will be a poisoning question, so the examiner will ask you how will you deal with it. So after doing postmortem or while doing postmortem, you have to collect viscera. So what are the viscera that you will collect is another question. So you should state that you will collect stomach and its content. Okay, stomach and its content, 500 grams of liver, longitudinal section of each half of both kidneys. Okay, all this, and with sample of blood, urine, all these things. And what preservative you will use? Normally saturated solution of salt is used for the viscera, and for blood and all you use normally urine you use thymol, and blood you use normally one sample is no preservative used, other one preservative can be used. It depends. Okay. So these are this is about PM, postmortem. Okay. Now we'll talk few lines about formic acid and boric acid. So boric acid है दो तीनटे लाइन मने रखते होबे. If signs and symptoms will be same, but the most important one is that it will cause erythema, reddish color hobe. Jodi boric acid skin e pore, it will cause reddening of the skin, erythema hobe, and it will cause desquamation of the epithelium. Desquamation of the epithelium hole ki hobe, it will mimic that of a 10 bole ache toxic epidermal necrolysis due to staph. Okay, staph infection hole oi 10 hoy toxic epidermal necrolysis, the skin will desquamate and fall off. So this boric acid also will mimic that staph infection. Fine. So the person will look like a red lobster. Okay, erythema howar jonno. So that was about boric acid. Boric acid, generalized erythema resembling boiled lobster. Okay. So other things about it is used as an antiseptic and insecticide as well as preservative. Okay. So this was about boric acid, and few lines about formic acid. It is also an organic corrosive acid, and it is colorless, pungent with penetrating odor. Its odor is very pungent. Colorless, formic acid is colorless and odor is pungent. Okay. It is used in electroplating, in rubber industry, textile industry, paper industry. Okay, as well as stain remover. It also causes, same as other poisons, it causes coagulative necrosis. এগুলো same হবে. Acid মানে coagulative necrosis. Alkali হলে কি বলবে? Liquefactive necrosis. এটা যেন মনে থাকে. So fatal dose is about 50 to 200 ml. And signs and symptoms in GIT, there will be burning sensation. Main thing is that it causes hemolysis. Okay, the main action is it causes hemolysis and it causes the ATP synthesis to be diminished. That is the main action. And other symptoms and all are same as other poisons. In GIT, there will be corrosion, hematemesis, ulceration, vomiting, all those. Respiratory system, it will be cause respiratory distress. Cardiovascular system, it varies. It can cause tachycardia or bradycardia, and hypertension or hypotension, both are noted. So main is hemolysis. It causes hemolysis. So the poison which causes hemolysis is, you will state, formic acid. Fine. That is the main catch line of this poison. It causes hemolysis. Okay. Organic corrosive acid that causing hemolysis, you should say it is formic acid. Fine. And in alkalis, almost all it will be similar to acids. Only thing is that few features, liquefative necrosis and penetration power is more. Penetration is more in alkalis, and it causes saponification. Okay, all these things due to its hydroxyl group ions. Okay, those things you should state, and other things are same.